Okay, here is the project I worked on last month, April 2025. I titled it National Hospital Patient Insights. Okay, here I have 4 pages inclusive of the home page, the demographics and admission info page, medical insight page, hospital and insurance page. Alright, okay. Before we dive into the insight, can we just look at what our data looks like from the table view? Here is our data on the table view. Great. I think let me show you the data. Here I have my age group here. Okay. Let me show you from the query editor the data. Let me show you the data on the query editor. Alright. Okay, as it's loading, one thing about Power BI is that when you upload your data, Power BI automatically assign a data type to each column. All right. Now it is your responsibility to ensure that each column has its specific or adds the right data type. Okay. Like this is a patient ID. It has a test data type. You can see the data type from here. You can also change the data type in case you want to do that. Okay. You can come here, change the data type, whatever data type you want. All right. Okay. Here is the age. You can see the age in whole number, the gender, the blood type. It is not only a we have a lot of gender what's it called blood type, not just we have O negative or positive. You can see them maybe that's it. The gender also we have both, we have male, female, and the one that was not specified either they are male or female, non-binary. Medical condition too, we have a lot, not just hypertension, we also have diabetes, there is cancer there also. Okay, you can see that they are in this and also in text, the data type. Okay, then the admission date of admission to see it is ensured when you have a date in as a column, when you have column one of your columns, ensure that the data tab is assigned date. All right, here you can see that this one is already assigned date. This is doctor text insurance provider text billing amount, that's the amount for each patient, the amount they have to be paid for, for treatment. Okay, it is already decimal number. We have the room number. We have the admission type. Either elective. When you check elective or gent, I think we have about three there, but let me check the third one there. Okay, emergency. Alright. Then we also have the discharge date. Also the medication, prescribed to each patient. We have a lot of it there. We have the test results, either abnormal, normal, or inconsistencies or that. But let's check what is the test result. You can see inconclusive, normal, abnormal. The hospital latitude and the longitude has to do with the location. Then we have the length of stay. That's the length of stay for each patient in the hospital. Okay, so that's all. I'm only showing you this project has been worked on, so I'm only showing you. So there's nothing for me to apply. I'm not applying anything because I didn't do anything, so I'll just close. Okay, now let's dive into our insight to check what we have been able to do. All right, just click on your control, click on the demographic or anyone you want to click, so you can easily navigate from one page by control, and you click on any of the page. You can see hospital insurance. You can see that it is responding. All right, and also our slicer are connected to each other. So when you click on, let's go back to our demographic and get information. Now, for instance, I want to check information about now. Okay, before then, let's look at this is the distribution of the blood group for the whole data set. The age group, we can see that the 36 to 60 that's the highest age group that we have. Blood group that we have is A plus. We can see the gender distribution. We can see the admission type distribution. Okay, let me just click in case you want to find out for each hospital. Let me click Mayo Clinic. All right. Okay, let's check. This is Mayo Clinic. You can see the blood group for Mayo Clinic. All right, Mayo. We can see that A plus is the highest. For the age group is 36 to 60. We can see the gender distribution in Mayo Clinic that we have. That's 80 for female is 50.08%. We have 10 points. So they have more of female content. No, the male is 39. So they are more of female compared to male and the non-binary. For the admission type, emergency is 32, elective is 33, and the urgent 2 is 33. We can get information. Okay, remember here that we chose Mayo Clinic. By the time you come to Medical Insights, all right, you can see here that also it is selected Mayo Clinic. All right, we can get the average length of stay by medical condition. Based on their medical condition, we can get their length of stay. All right, you can see the medical condition here: asthma, hypertension, cancer, and the rest. Okay, we can also get, you can see the information here also for this that has to do with the count of medication. All right, you can see. All right, for the average of billing too, you can also see it. You can also check for the doctor, for each the doctor that attended to them in each. You can get information based on the hospital. All right, so this is a very interactive dashboard. All right, you can also check for medical condition, which is cancer you want to find about in all. You can get information about it. All right, also the gender too, you can also get information about it. Also for the insurance provider, you can get information. All right, if you go to the hospital insurance too, you get information about insurance provider. All right, the average billing by insurance provider, the hospital by their test result, the count of patients also by each hospital, so you can easily know how many of patients we admitted in so hospital. All right, this has to do with location of each hospital. We have the total patients that we have in all the data sets, the average costs, okay, the average length of stay of each patient. We can see all this information on this project. Okay, I'm just showing you this project has already been done by us anyway. So just for you to know what we have done so far in this project, this is what we have done so far. All right, this project, this visualization will be posted on our YouTube page called the Data Lens. All right. Okay. Please, please kindly share, subscribe to our YouTube channel. So anytime we upload anytime we upload any of our works, you'll be able to see. And please click on the notification button so that you can get a notification regarding any upload on our YouTube channel. Please like, share, comment on our YouTube channel. We want to hear from you. Thank you.